Welcome to Sex and Breakfast, the sexy way to start your day. Dishing out sexpert advice and spicy insights about sex, love, and everything in between. Hosted by sex coaches and therapists from around the globe. What's brewing today is some vaginal health, from learning to take care of your vaginal biome to products to avoid and other ones to help you stay healthy. When you think of your shampoo and makeup, there are so many companies that are revolutionizing the industry to make products safer and cleaner for you. But unfortunately, companies aren't really talking about products the same way when it comes to your vaginal health. Your vaginal biome is similar to your gut biome and your mouth biome and your eye biome, all the places in your body that are made up largely of mucous membranes and react differently than just the rest of your skin. It's not like your vagina is a purse on your shoulder that doesn't affect the rest of your body. Think about the gut biome and how much it represents in your overall health. When our bacteria is not aligned in our gut, not only are we not digesting properly, but it actually wreaks havoc on our entire immune system. Women that have higher levels of bacteria in their vagina complain about odor all the time, that they don't want someone to go down on them because of the way they smell. They are more susceptible to other STIs. And we also know that there's a connection between BV, bacterial vaginosis, and other concerns the longer we go without paying attention to our vaginal health. And the longer we wait, the more complex the problem gets. So fear no more, vagina owners. This talk is about how to take care of the vaginal biome and keep you thriving. You see, the vagina has a natural biome. Its natural pH balance is 3.7, and there is a science behind keeping that balance healthy and thriving. A study in 2010 came out after trying to work on a buffer gel for HIV and STIs, where biophysicists discovered that all lubricants out there needed to be remade or rethought, because they found using products with propylene glycol and other chemicals draw out the moisture of the cells in your tissues. So basically, the first layer of defense in terms of your own immune function in your vagina is lost. Just to put this in perspective, your normal vaginal osmolality is 290 kilograms. Semen is 340. Propylene glycol is 10,000. So that's 30 times heavier than our own tissue. And it's driving the pH up and making you about 60% more susceptible to HIV and STIs. The most common infection with women between 15 and 40 is BV, bacterial vaginosis. So for women who have recurrent BV, you need to understand how to restore your natural biome to its proper pH levels. And things like having sex when we bleed, wearing tight yoga pants for too long, when we travel and visit too many bathrooms, all of these things can mess up our natural biome. The body is unbelievably intelligent. So if you're a believer in homeopathic medicine, you give the body just a tiny bit of what it needs, and then the body creates its own immune function. We always want to use products that are most familiar to our natural state of the body. Really, it's about just bringing your biome back to its natural state, and then your body knows what to do. So ladies, I know that this is something that a lot of our clients struggle with, especially when it comes to painful sex and just having good vaginal education. So I'd love to hear what other products or concerns that you advocate for yourself and for other vagina owners.
Yeah, Nicole, I'd love to chime in here. Yeah, I'll just share a quick personal story. Like, this is something I've, over the last couple of years, dealt with and had to go to multiple gynecologists and advocate for myself and search for second and third opinions, because I was stuck in the loop of exhibiting symptoms, and then I would be prescribed antibiotics, and that would give me stomach problems and ruin my stomach microbiome. And I did this over and over for years, until I finally found a gynecologist who was like, hold on, this is not the ideal way to treat this. We need to actually heal your vaginal microbiome, so that you can actually be more resistant in the grand scheme of things to the fluctuations and environmental shifts that you may occur. So I really love empowering my clients to not only get labs from their gynecologist, but also subscribe to a service like EV Bio, where you get to swab yourself and get more detailed results, so that over the course of like 3 or 4 times in a year, you can see the details of what your microbiome is comprised of, not just do you have yeast infection or do you have an active BV, because only then by understanding over time how the healthy shifts, and then getting coaching from a service like EV Bio, which is included, you can say, oh, okay, this is what will cause my microbiome or to shift, or maybe this is how I can eat better. And that's how I was finally able to break out of this loop. And it wasn't through my gynecologist specifically. I had to seek out other sources. So that's like the number one thing I ask my clients, especially if they say this is the second time in a year they've suffered from something like this. Yeah, that's kind of my take home tip, as far as labs go. I'm curious to hear from somebody else in that department.
I love this topic, Nicole and Norland. That's so cool to know that there's services out there that help vagina owners diagnose outside of the gynecologist, because I'm in the same vein where my gynecologist is like, nope, everything's fine. I'm like, this is when I was younger, where it was just not something that, like, I knew something was wrong. And this is before, like, I was on the other side where I needed the probiotics and that kind of thing. So that really helped balance my microbiome. And also, Nicole, I love the thing you're like, yes, extensive traveling, been there. That messes you up. And also, different sex partners, that could mess you up as well. And by mess you up, I mean like things just don't smell, feel right down there, kind of thing, outside of having an STI, which always you should, anyone should be checked for 100%. But yeah, I didn't know that there were these other services, because my gynecologists, plural, have not supported me. That what actually helped me was the homeopathic medicine portions of, like, my searches and all that kind of thing, of like, what can I do, how can this help me, and how can I be supported, like how can I support myself through taking these things. And I would go through, I have like a natural homeopathic book that was super helpful in my searches as well. So thank you for bringing this up. This is amazing. Yeah.
Yeah, and I'm not surprised to hear that you have a similar story, because when I took these results from this at-home kit and I had this multi-page showing the percentages of, my gynecologist was like amazed. She was like, I didn't know this existed. So now she can like suggest it to more of her clients. So this really demonstrates just, as soon as you have a conversation with other women, 9 times out of 10, they'll say, oh yeah, this happened to me before, where my gynecologist just gave me antibiotics. And then that was the end of it. Right.
Yeah, I feel like I've heard that story from many friends of mine, by the way.
Yeah, and the thing about antibiotics, and I don't want to be antibiotics. There are some times when you need it, but what happens when you take an antibiotic, gel or oral, is it's killing your bacteria, good bacteria and bad bacteria. And so, what is not really educated among a lot of people is to know that when you are taking an antibacterial medication, you're starting from zero and you need to work back up to a natural, healthy vaginal biome. And, a strong natural vaginal biome is, it isn't also just a sexual issue. this can happen with people that are not having sex. There can be people that are having pain, not related, that are not sexually active. And so we really want to start changing the education around our vaginal biome to really think about like our gut, because I think there's just been so much more education about gut health and how it's so interconnected to everything, that we want a healthy gut, we want a healthy vaginal biome as well.
Yeah, I really appreciate you bringing up this topic as well. I mean, on the same vein, I think in Singapore, sometimes they prescribe us a probiotic together with antibiotics so that we can start building up our guts as well. So I think talk to the healthcare provider if they're open to it, what kind of probiotic that's suitable, because there are also probiotic that can promote healthy vaginal biome. But yeah, really appreciate you bringing this topic up, Nicole, because this is such another underrated topic. I wonder if, for the benefit for the audience, would you be able to share, or one of you share, what kind of symptoms shows up when you have imbalances in your vaginal microbiome, and also, is it just infection, or could it be perimenopause that definitely alter and change the structure of our vagina, etc. Yeah, so I think it will be good to just kind of help our audience to understand what are the symptoms that we need to look out for.
So I think that we need to empower vagina owners to trust their own selves. And so, like as some of you had already said, that you went to a gynecologist and you're like, something's not right. And they're like, no, you're all good. If you feel that something is wrong in your body, if you're feeling that there's an uncomfortableness, a discomfort, an itch, a smell, a pain, that you're like, this does not feel normal, chances are your pH balance, your biome is probably a little bit off. And it's okay to seek help and try to work on it on your own outside of your gynecologist. And I love that you said, Dion, we're kind of going to go into products in a minute. So this would be kind of a great time to just talk about products. You did mention probiotics. Probiotics are really great for our vaginal biome. And also, if you think about anything that you're inserting into your vagina, it's really important that we're considering what is that pH balance, what does that and how does that affect our biome. So lubes are really, really important. Not all lubes are made equally, and there are some lubes that have a very different osmolality. Like I had mentioned earlier, that our natural number is 290. And so there's some lubes that are up in the thousands. And so what's happening is the moment that you're using this lube, it's taking away your skin tissue and it's disrupting your biome. So I have some lubes and products that I recommend. I'd love to hear if anyone else has them. I like Good Clean Love. They have a great lube. Uber Lube is really good. And I know Good Clean Love also has other products that are non-lubes for people that just want to work on their pH balance as well.
I'm a huge fan of using coconut oil, virgin organic coconut oil, because that is just like, for me, and I love the lubes you've mentioned, love, use, recommend, but coconut oil is just for me like the super sensual, yummy zone when, especially like if you're giving a partner massage or even massaging yourself, like you can use it for anything and anywhere. However, I would recommend people be very careful and have a separate jar of coconut oil in the bedroom and a separate jar that you use in the kitchen. As I've learned from experience, I see some of you laughing that, yeah, it's not a great thing, because You might get a yeast infection if you use your kitchen coconut oil in your vagina. Yeah, it doesn't work out well for you.
That brings up a really great point. You can make your own lube.
Yes.
So coconut oil is really good. I know about 4% of the population is allergic to aloe. So if you are, obviously don't use aloe, but aloe is also really gentle on the skin. A great way to find out if you have an allergic reaction to a lubricant is to put it in your mouth because it's the same mucus tissue as your vagina.
So another one I have used before is olive oil. Again, like the extra virgin olive oil. So, in the mouth, in the vag, it is fabulous. So, but it doesn't like the smell. Sometimes it's not for everyone, but it's not as yummy smelling to me as coconut oil, but it does the trick. And it moisturizes too, just like coconut oil, I gotta say.
And on products, if you're looking at a new brand and you're unsure, there's a lot of charts. If you just Google like osmolality lube, some of these keywords, or if you're looking at a new brand and kind of at the bottom you see like FAQ pages for this project or for the product, you'll find that the products that are willing to speak directly about osmolality means they've probably researched how their product stands up to osmolality and pH. So when in doubt, read their FAQ pages or look at charts that many professionals have put together to kind of compare the main brands out there.
I love that, Dr. Norland. And that actually reminds me, too, that although we're talking about the inside of our vagina, there's an outside and outer layer of our pH balance as well. And the soaps and the products that we use in the shower can also have an effect on our vaginal biome. If you think about your face, right? Like, would you put the same product on your face as you put like on your arm? Or the same type of lotion. A lot of people are very concerned about making sure they're using sensitive products on their skin, on their facial skin, but you're using these really harsh chemicals on your outer vagina. So that's another thing to consider as well as the products that you're using when you shower.
I guess when Nicole is mentioning all the products that you put, it's also detergent and fabric softener. Those are the things that need to consider. We may be very careful about that, but then, what kind of detergents and stuff that we're using, that needs to be taken into account, I suppose.
Yeah, and detergent then leads me to think about fabrics in general, because this is just something we don't really think about. There's so many synthetic fabrics that, especially once you've washed them, they start leaching chemicals. They can retain these strong, harsh detergents. And if you think about how gentle you have to be with what sort of soaps you're using in the shower, and secret, you actually don't really need soap a lot of times to clean yourself, to wash yourself. You just really need warm water and to just be really thorough. But many women, once they've built up their microbiome again, don't really need to use soap, or just the gentlest soap if you really feel like you need it. But back to fabric, I love brands that are conscious of this. And there's one in particular called Hoo-Ha. And I'm definitely going to put the link in the bio. I love the name. They've got products that are designed to not only be healthy for your skin, but also keeping in mind antimicrobial materials. This also connects with period underwear. Period underwear has been in the news in recent months because some of these period underwears were actually found to have PFAS families of chemicals, which are really bad for you. So when you're looking at period underwear, look out for the list of chemicals that are bad for you. And then when you wash those period brand underwear, you should be washing it with either the soap that manufacturer provides, that's really gentle, and hand washing, and making sure to follow the rule, or not the rules, the guidelines for washing those very special materials. And then my other favorite brand is Cotton Slut. I also love that name. And Cotton Slut's philosophy is really going back to just like cotton, and also keeping in mind that it's not tight. All of their tops, all their bralettes and their underwears are actually more like very loose fitting bloomers, because the creator of this brand was struggling with UTIs, and she was like, all her gynecologists in the States weren't helping. And then she actually consulted one in a third world country, and they were just like, you really need proper air circulation and loose fitting clothes, not these very tight, restrictive, just pressed up against our vulvas. So once she switched to cotton, loose fitting to let her vulva breathe, her issues really cleared up. So for many of us, that could be the key, or the beginning of the key. So those are my two faves.
I love that you mentioned that, Dr. Norland, because a lot of times we could be having pain or an odor or something like this, and it can be as simple as changing the fabric, changing our detergent, being mindful of how often we're wearing yoga pants. I am a culprit right here. I wear a lot of yoga pants, but just being aware of like how often we're wearing like tight clothing, and the circulation that we're getting and the ventilation that we're getting can make a huge, huge difference in our vaginal health.
Yeah, when you get out of the shower, just like air dry, just like give a little time before you throw on those clothes, and just kind of enjoy the feeling of air air drying. It can be really healthy for you.
Yeah, and I was going to say the other thing I've heard is like sleeping naked is so healthy for you and healthy for your vagina, and healthy for your whole being. I mean, if it makes sense for you, if it's not freezing where you live, or you're not ovulating, or not ovulating, not, you know what I mean, if you're not on your period or something like that.
And to that note, you can also free bleed. That's been a practice that I've been exploring too. Free
Okay.
bleeding it's not for everyone, but if you have the space to do it at home, there's special towels that you can sit on that absorb. So like sometimes wearing pads or underwear for every single day of your period.
Mm-hmm.
But again, I understand it's not for everyone, but it's something to explore.
Yeah, I was going to say I had a client one time, I invited her to just go commando, be free of underwear for just 30 days. And lo and behold, that's her lifestyle now. It's just like, I'm so proud of her. She's like, yeah, I tell all my friends about it, like changed her entire microbiome. It's something that can be so simple.
Wow, that's awesome.
Right? It's so cool.
To add to that, it's not for those who are not on the free bleed movement or going commando movement. For some of us, we still use pad or tampons, right? We also need to be careful with the type of tampons or pad that we line ourselves with. So some of the pads and tampons has chemicals, bleaching agents, and all this kind of stuff. Gels that absorb. I don't know if that's still available in the US, but I know in Asia they have this gel that can absorb things, and oh goodness, I don't know where that gel is gonna go to. So just having more mindfulness around what we put in our body daily and monthly is also important to consider, I suppose.
Yeah, the FDA are trying to make sure things are safe, but many lubricants that you find in sex stores have not been approved by the FDA. But the first thing you want to look at, like Dr. Norland had mentioned, is the osmolality. The second is the pH level of the lubricant. Um, and a lot of petrochemicals are in products that are put in there to help preserve it so it lasts a long time. And a lot of parabens. These products, the ingredients are actually legal in Canada and Europe and the US. So just because something's legal and you find it in a sex store doesn't necessarily mean it's healthy for you or it's a good product. Fragrances too have a lot of chemicals in it. So I recommend if you have a pad or a tampon or anything that has some type of scent to it, that is generally really harmful for your vaginal biome.
And I'm just remembering this tip. If you don't have access to, what are they called? A bidet, a bidet. Bidets are really, really nice to have. And they're, even if your house didn't come with a bidet, you can buy very inexpensive additions. And
$10 on Amazon, so cheap. Everyone should have a bidet.
yeah, and that has really changed the game for me as well, just to be able to rinse off and not just it just doesn't matter, just to get a nice rinse off. And when you're traveling too, if you're camping or going to be in a place that doesn't have a bidet, you can buy a handheld one, which is basically just a um, squeeze bottle that you can fill up at the sink, and it has the little spout, and you just squeeze away, and then it's your traveling bidet. So that really saves me when I travel.
My goodness, I forgot about that because in Asia or in other part of the, I mean, in this part of the world, we don't have. We okay. Some has toilet paper, but we also have bidet on top of it. So when I first go to um, Europe or US, and they don't have any bidet, I was like in panic mode. Like, how do you clean? Yeah, how do you clean yourself with just a tissue? So and it took me a while to learn when you wipe your tissue, wipe it from the front to the back.
Yes.
I know this is a very basic information, but this is also useful information to have because then you don't want to get the bacteria from the back move to the front, and then that would just wreak havoc. And this is coming from someone who grew up in a country where we use bidet, and that's the cleanest method ever. We don't even use soap. Sometimes we just wash it, unless we do number two, of course.
Yeah, because Dion, you're coming from Indonesia and Singapore. So for people that are like, wait, where do you live that has no toilet paper?
Well, in Indonesia, some places in Indonesia, especially in a remote place, we just really rely on water. But of course, in Jakarta or Singapore, it's quite modern. So we have both. We have the bidet and we have tissue paper. It's just, just a personal experience that I find it very illuminating is the way we wipe our tissue as well, and the type of tissue paper we use, because certain tissue paper has again chemicals and all the other stuff that i- impact our vaginal biome. So there you go.
And if you don't have water and don't have a travel bidet, what are the other options? Uh, Baby wipes, again, looking to make sure baby wipes are gentle. And also, I saw this recently, a new product. I don't know how long it's been out. Maybe it's just new to me. It's this, you can get like a little purse size gel. So if you're not going to be carrying a pack of already wet baby wipes, you can have this like gel that you can add essentially to the tissue paper, and then wipe away. So you've now you have all these kind of options on the go to really make sure you stay feeling fresh and prevent um, BV and yeast infections on vacations, because that's the worst, honestly, the absolute worst.
I would like to promote we're not getting paid promotions, but the brand Eurovagenius. It's a purse size biodegradable thing you can flush down toilets. So there you have it. It's called Eurovagenius brand, and they have all these natural scents, and it's biodegradable kind of thing. So I love them. I've recommended them to many people. Yeah.
And it's a wipe.
Yeah, it's a wipe. It's a wipe.
Okay.
I love these names.
Yeah.
Yeah, I have a one I use as a bookmark. Like there always comes like a little top. It like it says "Serve a Genius," so I just keep it by my art set for painting.
Yeah. No, these are all so good. We're going to put all of these resources in below. One of my favorite things to do with someone who just wants to empower themselves with are vagina owners is to start a vaginal care just regimen every day. We do amazing things with our face because we care about our face and we want it to look good. Well, why aren't we doing that with our vagina? We care about our vagina. We want it to thrive and be healthy for the entirety of our lives. And so we're going to put all these wonderful products down there. If you have more questions about this, we've really only hit the surface of vaginal care. I haven't even gotten into how it affects penile tissue, but it does the same way as a vagina. If we can geek out and talk about, the clitoral legs of the vagina are what makes the difference in the 8 weeks of utero. So it is a very similar tissue to penile tissue. So if you are a penis owner and you're having pain, know that there can be tears in foreskin with unlubricated sex, that BV germs are carried in foreskin, but that is a totally different topic. And hit me below if you want to hear more about that. But thank you so much for tuning in today, and stay tuned. Until then, send us some love by sharing, hitting subscribe, and leave a review. It really helps us connect to more incredible people like you. If you want to learn more about sex coaching or therapy, you can find us at sexandbreakfastpodcast.com, and be sure to follow us on Instagram at sexandbreakfastpodcast. The people helping us cook this all up are Michael Merle, creating our tasty tunes, dishing out our audio and video is Max Rainier, and our delectable visual designs by Brie Vilaubi.